We're going to go through some basic stretch and massage techniques for the forearms. So these are useful for anybody who's suffering from repetitive strain injuries, tennis elbow, golfer's elbow, or any sort of neural irritation syndrome. It's coming down the arm, leading to pins and needles in the hand, etc. So what we're going to go through first is a stretch for the flexor forearm. So pop the fingers up, use the other hand to evenly clasp all the fingers, pull them down towards the ground, and slowly rotate the elbow through so that it's in full extension, the wrist in extension. I'm feeling a strong stretch up through this flexor forearm here. I'm going to hold that for about 15 seconds, so a nice steady count to 15. So keep holding that. As the muscles start to release, pull a little bit further into the stretch. Okay, once we've done that, we're going to do a stretch for the extensors, so the bulk of muscle at the top of the forearm here. Now loosely clasp the fingers, don't make a tight fist, just curl them up, tuck them under, and same thing, we're going to rotate the elbow outwards until we're getting a nice strong stretch, and just gradually increase the pressure. We only want to achieve about a 3 out of 10 discomfort at the most with the stretching. It shouldn't be painful, you just feel a strong stretching sensation. Hold that for 15 seconds. If I was doing this at home, I'd actually repeat that 2 or 3 times on each side, so I'd go backwards and forwards through that stretch. The next thing that we're going to do is a self-massage technique. So the first area that we're going to work on is these extensors here. I'll just rest my arm across my waist, pop the other hand over. We're going to use the thumb a little bit like a blade. And because our muscle fibres are running lengthways here, we want the thumb to drag across, so we're mobilising those fibres and breaking things up a bit through there. So then I'll pop my hand on and just rotate the other forearm to break it up in there. If you find any particularly tender points, then give them a little bit of extra attention. Get stuck into them. Same guide, about a 3 out of 10 discomfort. You don't want to be wincing in extreme pain, but some of the points will be a little bit uncomfortable. So break it up through there. Once again, if I was doing this as part of my self-care routine, I could spend anywhere from 30 seconds to a couple of minutes doing that. Next, we're going to move into the triceps insertion. We've got some other major nerve branches running through there as well, so we make a bit of a stop sign with the opposite hand, tuck the thumb in, and we're going to do the same thing. We're going to rotate the wrist and drag the thumb across through that tissue. And just spend a minute or two breaking it up in there. And if you've got symptoms affecting both arms, then you can simply repeat this procedure on the opposite side.